Good morning, everybody. Welcome to this webinar on the new NICE guidance. This is an event that's really for community stop smoking services, but there may be others on here that will find it useful and interesting. I'm just going to do a few introductory slides. I'm Hazel Cheeseman. I'm Deputy Chief Executive of ASH, and we were just having a few technical problems with our first speaker. So hopefully, as I go through the introduction, we'll be able to get her in and started, but if not, we might slightly switch the agenda around. So just to go through the agenda, as I've already said, I'm Hazel. I'm Deputy Chief Executive of ASH. We've got three wonderful speakers today, and hopefully Sophia will be our first speaker. And Sophia is at the NCSCT and has joined the NCSCT from Canada, where she did a variety of things, including being heavily involved in the rollout of the Ottawa programme in Canada. And so Sophia is going to give us her perspective on the new NICE guidance and the implications for stop smoking services, and hopefully give us a really good overview of that guidance and the practical implications. And then Allan, who many of you will know, is in the national team, now formerly PHE, now Office for Health Improvement and Disparities. And Allan's background is in stop smoking, local government stop smoking delivery, formerly in Kent. And so Allan's going to be talking about some of the practical tools that OHID have developed to help us implement the new NICE guidance. So specifically looking at the new Clear tool. And then Louise Ross, who many of you will know, used to run the service in Leicester and now at NCSCT, will be looking at the guidance around e-cigarettes, the new guidance which has been developed by NCSCT and OHID, following on from the publication of the NICE guidance and looking at how we can better commission into services. John, how are we doing? Have we managed to get Sophia up and running?
I'm not quite there yet. Let me just.
Okay, so we might start with Allan.
Let's try it. Let me just try and do it. I think I can do it.
Great. Just a little bit of housekeeping then before we start. Please can people submit questions in the chat function on Teams. Hopefully we'll have lots of time for questions at the end. It's being recorded and the recording will be uploaded and shared with attendees and more widely, and it'll be on the ASH webpage. And please, you shouldn't be able to unmute yourselves, but just in case you can, make sure that you are muted and you've got your web cameras turned off, so unless you're presenting, and otherwise we will mute you. Although at the moment we very much like to unmute Sophia. So I will stop sharing my screen and just see if I have sound. We got some problems with sound as well in the chat.
I think it's just one or two people.
Just one or two people. Great.
So Sophia should be able to unmute herself now.
Sophia, do you want to have a go at unmuting yourself? Just give it a moment. Okay, doesn't seem to be working, or at least we can't see her. Allan, I think we're going to have to ask you to go first, and then hopefully we can resolve. Hang on, Sophia. Oh, she appeared and then she disappeared. Oh dear. Right, we'll continue to battle with the technology. Allan, can I ask you are you sharing your slides, or do you have your slides? Are you able to share them on the screen?
John has those.
Yeah, I'll do it.
Okay.
1 second. Great, can you see that?
Thanks, John.
Okay, thank you, John. Thank you, Hazel. Hello, everyone. I'm Allan Gregory. I'm at the Office of Health Improvement and Disparities, formerly of PHE, and I work in the tobacco control team. And I'm going to talk to you today about implementing NICE locally using the Clear tools. So I'll give, a lot of you will have knowledge and understanding of CLEAR over the years, but I will give you a very quick 101 of what CLEAR is. But just because I don't want to steal any of Sophia's thunder, I won't necessarily be telling you how to implement NICE guidance, but I will be telling you how to take an assessment of where you are in terms of delivering NICE guidance locally. So that's one of the clear aims of the CLEAR tools, is to be able to actually map out activity that's going on. And we're not just restricted to NICE guidance here as well. We're looking at best practice that has been identified over the years as well. Okay, next slide, please, John. Okay, a busy slide, but hopefully this encapsulates all that CLEAR is really. So CLEAR is very much based in the evidence, as I say. So it offers a number of questions and assessments of a local system. And we put out a lot of those NICE guidance, a lot of elements of NICE guidance to actually ask yourself and benchmark yourself against, okay, are we delivering against NICE guidance X, Y, and Z? But it is very much to be used across the system, and it's been developed as a system-led improvement tool. It's originally developed by ASH many years ago now, then managed by PHE and now in OHID. And the key thing here is actually looking at those established standards of good practice locally and saying, okay, how do we measure up? Are we delivering against those standards? And you're not necessarily doing this in isolation, you're doing this as a whole system. So this isn't necessarily just for one part of a system, one organization, or even one team to undertake this. It's an opportunity for everybody to contribute and get some real cross-fertilization of ideas and different approaches that are happening locally. The assessments themselves are meant to identify areas of strength and weakness. And therefore, one of the main outputs of the CLEAR assessment is it gives you a basis for developing an improvement plan. It's probably worth also noting as one of the sort of secondary sort of objectives. Over the years, when talking to people who are looking to pick up the pen and lead the assessment locally, I always ask, what do you want to get out of this? And so, yes, there's an improvement model, so we can improve our comprehensive tobacco control action locally, but it also enables you to do some other things as well. So it may help you to re-establish, reignite, or even form, in the first place, a tobacco alliance. Tobacco alliances go through a sort of cyclical sort of wave of understanding of people coming together, and then sometimes people may drift apart. It may be an opportunity to reignite the agenda on local tobacco control. CLEAR gives you that opportunity because it enables you to re-invite and also look at those partners who may not have historically engaged, or those you want to develop better relationships with, to actually invite them around the table, or the virtual table at the moment, to actually say, okay, we need your input to this. So it's a legitimate way of re-establishing an alliance, re-establishing a system approach to tobacco control. It's a real good tool for that engagement. I've mentioned about comprehensive tobacco control, but can we go back a bit, John? Apologies. I mentioned about comprehensive tobacco control, but over the years, what we've had is some requests to say, okay, we've identified a particular area we want to really delve into a bit further. And so one of the things we've also come out over the years is developing these deep dives. So using the CLEAR format, but focusing in a more narrow area. And I'll come on to those, give you some more examples of those in a moment. It's worth noting that over 85% of local authorities have already participated in CLEAR. So CLEAR won't be alien to you, it won't be new to a lot of you. But it's just worth reiterating as well that what CLEAR stands for. So it's about challenging your existing tobacco control services. It's about the leadership for comprehensive action on tobacco control. And it's also about assessing the results and demonstrate the outcomes. It helps you say, if we do deliver against the standards that are in, for example, in NICE, these are the sort of outcomes we can have. It's also the next page. We'll tell you a little bit more about the deep dives that have been developed. So CLEAR, in essence, originally designed for local authorities to actually sort of take a lead and to understand there at the time when public health moved over to local authorities. This is one of the first sort of models that came out to actually help support some public health engagement and give local authorities an opportunity to talk with other stakeholders and really drive the agenda forward. And it's developed over time to be, we've done reiterations over the years to say, okay, the NHS now have a long-term plan. What more can we do there? Also reflecting the changing structures in the public health landscape as well, with ICSEs, ICPs coming on board. So What we have done is we've tweaked this over the years, and we've got a new tweak, which I was hoping to announce today, and it's been published, but it's going to be published imminently. So a new version of the tools, which are a bit more fit for purpose, not only to reflect the new public health landscape, but also that new NICE guidance that's come in as well. So you'll find that the tools no longer refer to pH 48, etc. It now refers to the new NICE guidance, NG 92. Have I got that right? I'm looking over Sophia. Excellent. So it's reflecting the new NICE guidance as well. So bear in mind that the main assessment is about comprehensive local tobacco control, but we now have these deep dives for acute settings and maternity, smoking and mental health, smoking during and after pregnancy, some interesting ones on illicit tobacco and compliance with regulations, and some niche tobacco products as well, which is proving popular in certain areas. And we've also, just so you're aware, we're developing, been a while now, been a lot of interruptions over the last year or two with COVID, but we're developing a deep dive looking at stop smoking within drug and alcohol service settings as well. Next slide. So the clear outputs. It's a process is the main thing to bear in mind. So I see it as a very basic strategic management model. Where are you now? Where do you want to be? How are you going to get there? So where are you now? The tool enables you to document and get input from wide stakeholders from your system about what your current overview of local tobacco control activity is. So the series of questions, which I will show in a moment, will actually say, okay, show us the evidence. Where are you? Where is your current overview of local tobacco control? So you do a stock take in essence, but it also enables you then to also talk to all partners to understand where you want to be. Yes, we want to reduce smoking prevalence, but it may be other things that you can get out of the system as well. So it enables you to look at and collate all the local strategic and organisational objectives where tobacco control can have an impact. So it's understanding those hooks and those golden threads through all different organisations, different partners, different stakeholders objectives to make sure, okay, how can they also deliver against a tobacco control agenda as well? So you get a clear view of where you want to be for all stakeholders. And then obviously at the end of that, you can then say, okay, we know where we are now, we know where we want to be, but how are we going to get there? And so one of the outputs that you can get from the clear assessment is it comes up with a list of you identify recommendations as you go. And it's up to you what you turn into those recommendations. Sometimes they may go forward into, okay, we've now got a proposal document based on the assessment, propose an improvement plan. That could be sort of a business case. It could be a new strategy, a local strategy document. It could even be a work plan for your alliance partners going forward. Why do the clear now? We've mentioned updated NICE guidance. What an ideal opportunity to do that stock take against the new NICE guidance. We've mentioned about the new local health systems and networks are in place. So it's an opportunity to embed tobacco control in those key in those new systems, in those new structures locally, to make sure tobacco control is seen as a priority. And it enables you also to actually say, okay, once we do the clear assessment, where's it going to go next? Let's make sure it's delivered at an ICS board as well as a health and wellbeing board. Let's make sure it's embedded in the plans going forward in the new local health systems. We've seen a lot of work with the implementation of the NHS long-term plan, where the deep dives in particular are being taken up, especially by ICSEs, saying that they want every acute hospital to undertake a deep dive in order for them to do a sort of baseline assessment, and also a sort of a governance role, really. If we're getting, if the trusts are doing a deep dive in acute stop smoking services, in the acute services, it enables that ICS to say, okay, here's the funding that's coming down. So we're seeing clear being used in that way quite a bit at the moment, as a sort of a governance and a stock take to see where the improvement plans lie. We're seeing a lot of talk around using tobacco as a key point in terms of COVID recovery planning. There's always the issue around addressing health inequalities. I don't think I've seen any clear where one of the key requirements and key engagement tools were clear is around addressing health inequalities. We're seeing that everywhere, and we're also seeing waves of regional activity happening as well. So we're seeing clear being undertaken again. We've seen it right in the past, but we're starting to see a lot more now. Regional sweeps of clear exercises being undertaken, and peer support within that region, where people are coming together with their results from clear and sharing their learning, where they've got an improvement, identified somewhere an area of an improvement, then talking to a neighbour saying, you seem to have done well on that, how can we learn from you? So it's really getting that sort of cross-working going on as well. But very quickly, Going on to the next slide. I'm going to go through these very quickly. What is the Clear tool? It's an Excel spreadsheet. Series of questions, you score yourself. So looking at the comprehensive tobacco control Clear improvement tool, there are 3 main areas, as I mentioned, around leadership, which includes certain questions around vision and leadership, planning and commissioning and partnerships. Then we've got challenging your services. So we're looking there around prevention activities, compliance with regulations. We're talking about your sort of comms plans, your innovation learning and cessation activity, and then the results, which is quite an important part. It's also about how you're monitoring and tackling and improving trends against reducing prevalence. Look at your quality of your quit data. Are you actually helping support people to quit? And also an opportunity for you to identify and promote any sort of local priority indicators as well. So you may have some particular populations that you want to focus on. How are you making sure you're doing some good work and making some in reach and making some real good improvements in those populations? So it's an opportunity to be quite flexible and for you to bespoke the tool a little bit to say these are the areas we want to focus on. Next slide. It is just a very simple one to say how you're, and we can give a lot more support to this if you're interested and want some more support in terms of understanding how the best ways, and we can give you a lot of feedback on how people actually physically gone through the process of filling in the assessment. First of all, we always say that you don't do this in isolation, you don't do it on your own, and it's definitely not a tick box exercise as well. What we do is we have these statements and we ask you to rate yourself whether you've got some evidence, no evidence at all, or you feel quite clearly that there's strong evidence of achievement in your area. But one of the things I always say is you do the drop down tick box evidence score at the end. The first thing to do is to engage partners and get lots of comments about how you're supporting the evidence. So you can say, okay, get to this statement, we're doing X, Y, and Z. Get lots of voices in there, get lots of assessments, get lots of people, and it could be contrasting, it could be conflicting. Some people may say we're doing this point very well, others may say this is an area for improvement, but understand the variation of views out there as well. But it's an opportunity to embed documents in here, so you've got some sort of organizational memory as you go through the assessment. You know where that evidence of assessment is, and then collectively you can then as a group say, okay, how are we going to score ourselves here? You then have an opportunity to put some recommendations for action, and from that you would then bring out your action plans, your improvement plans. You may produce some summary papers as well. Finally, a couple of next slide. Yes, we'll send slide decks out. Just some key principles here. It's meant to be simple. It's meant to be relatively quick and easy to complete. Very easy thing to say. It's going to be easy and simple to complete, but it's simple and easy to complete if you're doing it in a collaborative way. Do consider the evidence and record the basis for your choice. So if you are saying we don't think we're doing as well on this, say why. Do put it in there, but above all, be honest. This is all about being in a safe space. We don't see your assessments, no one else sees them. You as a local system will sort of be responsible where you share them. We're not asking you to submit them to us or anything like that. They belong to you as a local system. Use them as you see fit. And so final slide. It's a team approach to give you a system response. You need a coordinator to sort of take this forward. We will need an opportunity to identify section leads, make sure you get those input both internally and externally. There's an opportunity here to identify your governance role as well, and who's going to be your exec sponsor. We talk about, the first page talks about leadership. You need to make sure you have leadership in the actual process and the system of undertaking clear as well. And the outputs and outcomes, what do you want from the assessment? I mentioned before about reigniting an alliance, or producing a certain business case, or producing a local strategy, doing a stock take. Final thing to say, there is an extended offer of support from us, so you can just go and download the resources. But if you can also contact us if you want us to provide any more support to you, as that, especially that person holding the pen who's sort of leading this locally, and we can provide some extra briefings to local teams as well. So the very final slide, Hazel, is just where you can get those tools, and our contact details for support. I'll stop there.
Thanks, Allan, so much, and thanks for stepping in. We have now got Sophia, thank goodness. Heart-stopping moment. So we please do add questions into the chat. So we're going to ask Allan to turn his camera off, and we'll invite you back when we get to the Q&A. And so Sophia we've now heard how we might implement some of the NICE guidance locally. So now it seems important to find out what's in the new NICE guidance. and what the implications might be. So I'll hand over to Sophia. John's just going to share your slides there, and thank you very much for persevering. Thanks.
Great, thank you, Hazel. You can hear me?
I can hear you loud and clear.
I had to check. Okay. Well, good morning to everyone. So I just wanted to take about 10 minutes to give a good walkthrough of the NICE guidance. As Allan's already referred, it's our new NICE guidance released in November of 2021. It's a long document. It's quite comprehensive. So there's a lot to go through, and we're not going to have time to look at everything. So I've sort of selected a couple of things that I think will be most of interest to you and have implications to service delivery and service design. So we'll kind of do a little bit of a walkthrough of this new NICE guidance. John, can you turn the slide? And go ahead and hit that again, John. There's a little animation. So I think of importance is NG 209, as it's called, tobacco preventing uptake, promoting quitting, and treating dependence, replaces several previous NICE guidelines, and they're listed below, and there are actually several more that it's replacing into one comprehensive document. There are good things and bad things about that. It's a very long document. It's 99 pages, and it perhaps addresses areas of tobacco treatment and prevention that maybe aren't relevant to everyone. The good thing about it is when we talk about integrated health systems and sort of front to end planning, it's all in this one NICE document now. In some cases, in particular for stop smoking interventions and services, NICE had just updated the guideline in 2018. In other cases, there had been some time since the last update, so they've received a bit more of a comprehensive review and update relative to the stop smoking interventions. So just wanted to highlight that. John, next slide. So the guideline itself is organized into recommendations for a couple of different important areas. One is preventing uptake, so it talks a lot about schools and communication strategies to address not getting people to start smoking in the first place. Promoting quitting, so that's getting people to services and how that's done. And there's pieces around communication, designing marketing campaigns, where to go to integrate and partner with other settings to ensure very brief advice is being delivered. And how to message directly to tobacco users, some of the nuances in what needs to be emphasized in order to be most effective with promoting quitting. The other section, most relevant, and we're going to spend most of our time this morning, is tobacco treatment dependence. And there's a specific section, a bit longer and more attention being given to tobacco treatment and pregnancy within this NICE guidance. And finally, the document ends with policy commissioning and training. So we'll go to the next slide and we'll dive in a little bit. So the good news, and maybe one of the key points with this NICE guidelines, is for the most part, the guidance remains common with the past. There aren't major changes to best practice, but there are nuances. But let's just start with what remains common with the past, and that is that combination behavioral support and stop smoking medication or a nicotine-containing product, by that we mean NRT or vapes, is still considered best practice. Not still, continues to be, and can't say that enough, that combination of what we are looking to offer to individuals looking to quit smoking. And that stopping smoking in one go is the best approach. And I mention that because there's a lot of talk within the NICE guidance about harm reduction, and we'll talk about how that fits into the context, but very clearly stated is the first recommendation is to quit in one go. Very consistent with what we've always been saying at NCSCT, NHS, and also Public Health England and all groups, is that if it's possible and if people are motivated enough to give it a try in one go, so abrupt quitting as we've called it, that remains the best practice. Service delivery targets remain the same, and you know these better than I do, but they're listed there. Those have not changed. They have not been touched. Next slide, John. Also, as it relates to training, and we've done lots of work at NCSCT to update training to reflect NICE guidelines, but truth be told that much of it was already reflected. But the training standard for those delivering stop smoking support remains NCSCT certification for all stop smoking advisors or the equivalent. And likewise, specialist training for those working with pregnant women and persons with mental health illness. And as you probably know, there are specialty courses available, both online and virtual courses for these populations and for all advisors. John, next slide. So what's new in this NICE guidance? That's sort of what was, a reiteration of the importance and a confirmation for us that we've been moving in the right direction, and it truly is best practice. But what is new are a few things that I'm going to call nuances, but they're important nuances. And for most of us, they are known, but it's nice to have them in a reference document and in recommendations published by NICE. And I'm going to put them under the categories of what you see on the screen now, but it's the importance of tailoring the quit plan to the needs of the smokers. So a real tailored quit plan is what's being communicated in this document, more so than we've ever seen it in the past as best practice. The promotion of greater flexibility around NRT use, that's coming through loud and clear in this document. That's something that we've advocated for through our training at NCSCT, so it won't be a surprise to you, but it's one of the first times we see it reflected so clearly in the NICE guidance and in many different places. A place for nicotine-containing vapes, for which there has been great support for amongst the tobacco control community in England, but in this NICE guidelines, as a first-line quit smoking aid, it's on the same level, and I'll show you a little bit further the exact recommendation, but sort of repositioning vapes in the same way we refer to stop smoking medications, rather than separately, as we've done for some time now. And clearer guidance on NRT in pregnancy and the role of incentives in pregnancy. And those two we've talked about for a long time, but there's very clear statements around these two areas that relates to pregnant smokers. Harm reduction, because this NICE guidelines has incorporated a previous NICE document on harm reduction. There's a big place for that in this document, and it also talks about sort of flexibility and how harm reduction approaches can lead to a quit attempt. So if it's not going to be done all in one go, as this document refers to, is supporting people with getting there through harm reduction approaches. Partnership, outreach, and promoting quitting is also a big part of the end section of this document, and we'll talk a little bit more about that. So next slide. I think an underlying message that's just worth stopping to emphasize is something that I think we all know to be true, is a flexible, tailored approach to quitting is key. For those who quitting was easy, they've probably already done so. And we've come to understand through experience on the ground, through evidence being generated through research, is that tailoring to local circumstance, to social circumstance, to levels of nicotine addiction, to past experience with quitting and response to treatment is really important to being able to keep an individual engaged in a stop smoking plan, but also ultimately to help them achieve greater success with their quit attempt. So that's coming through loud and clear in NICE, and I just want to make sure that we don't skip over it. It's really important that this is best practice in the view of NICE at this time. Next slide, John. One of the things that NICE has done in this 2021 version that wasn't done in the 2018 is rank stop smoking medications as more effective and less effective. And this won't be any surprise to you, but the terminology I think is important, sort of the distinction that this is not a list of first-line pharmacotherapies, but an ordering of them. And as we all know, varenicline, combination NRT, and nicotine-containing e-cigarettes are listed as the most effective, and there's great evidence around this that we could talk about at another time, but clear guidance around that. And less effective are the single forms of NRT and bupropion. I'm not suggesting this is anything new, but the wording being used, and in particular, the relevance it may have as we look at service design and what is available. And of course, that combining stop smoking medications with behavioral support is what is key. Next slide. There is an important section that is an update in this NICE guidance that I thought again was worth highlighting, and it's on educating on the role of nicotine in stopping. We know that despite our push to promote the use of nicotine replacement therapies or nicotine-containing e-cigarettes, that many people are reluctant, that smokers are concerned about possibly developing another addiction to NRT products, tend to want to leave behind that and give it a go on their own, that there is a little bit of resistance, but certainly we've done work to address that. But there is, in this NICE guidance, a bit of an emphasis making sure that some of these key phrases, these key pieces of education to individuals who are quitting smoking either before they make the attempt in order to get them to do so, but in order to support compliance with NRT or other therapies that they may be using, that it's important. And really it is that smoking is highly addictive, and that because nicotine is delivered to the brain, that it can make stopping more difficult. Some terminology there that we've already been using, and emphasizing that the risk of any nicotine-containing products are much lower than that of smoking. So NICE has put these statements directly in the document with the feeling that they're really important, that we become part of our mantra in community-based stop smoking services. And again, I know for many of us this is the case, but I did want to emphasize that they've dedicated page space to this particular topic around educating the public and those seeking treatment on these points. John, next slide. Very important, I think, are two, they're not fundamental and they're nuances, but they're important as it relates to commissioning and designing of services. And these are in section 1.22 of the NICE guidance. You don't need to know that, but it states, and I want to say it as it is stated here, ensure service specifications require providers of stop smoking service to offer nicotine replacement therapy, and here it is, for as long as needed to prevent relapse to smoking. And then just below in section 22.9, that they offer medically licensed nicotine-containing products on a long-term basis to help people maintain low levels of nicotine, of smoking, excuse me. So here we're talking about offering as long as needed. And next slide, John. I want to talk a little bit about something that we've communicated, I hope, in all of the training and communication that NCSCT puts out, but it's being reinforced here. Is we know one of the biggest problems with using NRT is that smokers just don't use enough for long enough. And the guiding principle for best practice in 2022 for tobacco treatment is as much as needed for as long as needed to manage withdrawal and cravings. And for many people, that will be simple combination therapy for 8 to 10 weeks. When we're referring to NRT, and for others that will be a bit longer, and that there are no hard and fast rules, and to have a flexible approach to the use of NRT is what is most important, and it comes under the framework of tailoring quits, but in particular tailoring it for both dose, and we've been doing that for a while, how much nicotine we prescribed, which products are combined that suit the individual's preferences and lifestyle possibly best, but also for how long it's used. So that's coming through clearly in the NICE guidance. Next slide. Just a word again to remind us around combination NRT. And I've added to the end of this the e-cigarette. So the patch, of course, is there to give a steady state level of nicotine. And the faster acting product does two things. One, it tops up the nicotine in the system to get somewhere close to the levels that might be required to assist with better managing craving and withdrawals. And it helps with breakthrough urges. So things that we may or may not be able to predict, that the individual smoker can self-titrate, can manage, if you will, themselves, how frequently it's used, and can top up as needed. So that's really important. And whether it's the gum, the inhaler, the nasal sprays that are used, these are all faster acting products. And the same principle can be applied to vapes. And Louise Ross will speak more about vaping, but I just want to, as we speak to NICE, putting it on the same level, look at nicotine-containing vapes as an option available for combination therapy. And we'll just move to the next slide. And this next slide is just a real quick example about how this NICE guidance and sort of the flexible approach that it's advocating for could be used for this particular smoker who smokes 30 to 40 packs a day. Giving them the opportunity to combine patch, in this case it would be the higher level of patch, the 21 or 25 milligram, with one of the NRTs or with a nicotine-containing vape device. And for someone who is smoking this amount of cigarettes, it is even possible to consider topping up further with the possibility of 2 patches and less use of one of the shorter acting products. So lots of flexibility is what's being advocated for in our work at NCSCT, but also within this NICE guidance. Moving forward. So just a few words, 2 slides on NICE guidance around tobacco treatment. I think one of the really nice things they've done is really clear wording on when to initiate nicotine replacement therapy for pregnant women. And the wording is, consider NRT at the earliest opportunity. That is the first time internationally I've seen that strong of a statement around pregnant women and NRT. We have not seen it before in any US, Australian, UK guidance before. And it's come to time, right? And we know the importance of quitting before the 15 weeks of pregnancy. It's valuable thereafter, but the message here is as early as possible. And in the past, there's been really strong guidance on being careful and being cautious, and only if they can't quit on their own. That was about 10 years ago. And then we started to say, well, give them some, but not too much. And here we are today sitting at the earliest opportunity. And then second to that in this NICE guidance is ensuring that we provide consistent information about getting enough to control cravings and withdrawal and address compulsory smoking and be able to do so to increase success. So early and enough is the 2 messages around pregnancy. And next slide, John. Again, around pregnant women, because there was a lot of attention paid to this issue of treating tobacco dependence in pregnancy in the NICE guidance, is around incentives. And there has been much work and much discussion in previous webinars on incentives, and they've made their way into the NICE guidance nice and clearly. And it is to ensure that in addition to behavioral support, that a voucher incentives be considered for supporting stop smoking, specifically in pregnancy, and as much as possible engaging not only the pregnant woman, but possibly a support person. And we've seen best practices across the UK with that, where a family member or a support person, such as a friend, is involved in the incentive program and providing training around that. So I won't say more in the interest of time. Reduce to quit has, appeared in this NICE guidance, and I wanted to, this is just from my perspective, share what I've learned about this for those services across the country that are offering reduce to quit, and how it relates to this issue of a flexible approach and what is being said in NICE. And what you see on the top of this slide is the standard treatment program, where we, see people over a series of weeks. We start with our pre-quit appointment. We give them some time to set a quit date. We see them around the time of their quit date, several follow-ups in our final visit, usually around the 4-week mark. That is intended as an outline, right? And if we're talking about a tailored approach, a reduce to quit model in the context of community-based stop smoking support can be that you bring folks in and engage them when they're not ready to quit, but it can also be a flexible approach around a soft start. So a couple of appointments, pre-quit appointments, where people are working on smaller goals as part of what might be called a harm reduction approach, but really is around a reduce with the intention of quitting, and allowing them to take some time to get to know the NRT products, the vape devices, to learn more about their patterns of quitting, and then set a quit date. So I mention that because it fits beautifully in the context of the work that we're doing, and it really is about sort of meeting people where they're at, being flexible, tailoring, allowing for experimentation, and being sensitive that they can still do well. And there are some best practices around making sure we do set a quit date and have some additional structure around that. So I don't want to say too much more on that. We'll just move forward. Hazel, am I getting the axe?
You are kind of, we're running out of time.
Yeah. So very briefly, the last section in this document that's I think Allan already spoke to is really important, and it states the use of integrated care system plans, health and well-being strategies, and other local strategies as far as building access to stop smoking support. So in the interest of time, we'll just go to the next slide. But there are a variety of ways in which that can be done, linking stop smoking services to the work that's being done in the NHS around delivering stop smoking support in the inpatient setting, and offering support and linking in the outpatient setting to stop smoking services. And the other really important thing that's emphasized is ensuring that very brief advice continues to be part of the mantra and the work that's being done to generate individuals who want to make a quit attempt and link them quickly to locally available stop smoking support. support. I have on the screen just the new very brief advice plus model. And, you know, a very easy thing we can all do, sort of inspired by this nice guidance, is to get in contact with, for example, primary care and remind them that there is training available for very brief advice, that there's a new model, and to sort of make those links stronger moving forward. Last slide, I think it is. Just a reminder, you know, that we've updated all of our training resources at NCSCT, and as many other groups will be doing, to be consistent with the NICE guidance, so you can feel confident that they're reflected there. The online training is of course there to support, and we know how important that is, but also there are virtual courses, 2-day virtual courses that are being offered and can be commissioned as needed. So I'll stop there and thank everyone for the time and the opportunity to speak with you.
Thank you so much, Sophia. I really didn't want to cut you off because that was so interesting, and we've had lots of questions. I think the likelihood is, please keep adding your questions. We will respond to them, but I think the likelihood is that we won't be responding to them verbally in the session today. But I would like to flag that some of the things that people have been raising around more stuff on smoking in pregnancy and more stuff on pharmacotherapies, we do have some webinars coming up which specifically deal with those issues, and I'll share a slide on that at the end. So I'd now ask Sophia to turn her camera off and invite Louise Ross to share her thoughts on the role of e-cigarettes and the new guidance which NCSCT have put out. So I'll hand over to you, Louise.
Thanks, thanks, Hazel. I'll try and be really quick so that we have got some time for questions. Let's go on to the next slide. And I'll be talking about the NICE guidance relative to e-cigarettes, but also the new guidance that was brought out jointly between NCSCT and OHID about how stop smoking services should include e-cigarettes or vapes into their service offer. It's really important to point out that there isn't yet a medicinally licensed vaping product. And when the headlines came out a few weeks ago, a lot of people thought that that would miraculously translate into the availability of vaping products to be prescribed. It hasn't happened yet. It will be some time, and I'll come back to that on a later slide. When people say they're not regulated, they absolutely are. The MHRA regulates them, and they're regulated for safety and quality. And stop smoking practitioners can be confident that what is brought in this country is safe to use for stopping smoking. And on my slide, there's a little note at the bottom on these 2 bullet points about the other things that will have to happen before vapes become able to be prescribed locally. Next slide, please. So this is what they say. They, as Sophia has mentioned, they specifically mention nicotine-containing e-cigarettes as part of the first line offer. So it's really important when you're translating this into practice to think, don't save vaping for, you know, when they've tried everything else. Most smokers will have tried everything else anyway at some time or other. If they're interested in vaping, or even if they're not, if you've got an opportunity to talk about the possibility of using a vape alongside behavioural support, you know, you might be seeing much better success. Don't treat it as second or third line. Look at their previous experience. Have they tried other things? If they've tried vaping before, check out what they actually used. Did they use it properly? Did they use a strong enough liquid? Was it just a cheap little device that didn't deliver a satisfactory experience? All that sort of thing is important to look at when you're looking at previous experience of stop smoking aids. Yes, the rest of the slide is self-explanatory. Let's move on to the next one. Thank you. NICE recommends that we give clear, consistent and up-to-date information. Now, the question is, where do people get their information from? And I'm saying here, please use authoritative sources. We know that a lot of healthcare professionals get their information from Google, which is full of fact-free information about vaping, and certain newspapers. So use the NCSCT as your source, or PHE. You know that that will be reliable and not subject to kind of speculation. The information that they ask practitioners to share about stopping the use of e-cigarettes, I'm going to pick on that particular bullet point, is interesting, because I think that when somebody presents at a stop smoking service, they don't know how long they intend to use a vape for. They have no idea. What we want to emphasize to them is that they use it for long enough to prevent a relapse back to smoking. That when they want to stop using it, that is a fairly simple thing to deal with. But don't start them on a vape and then start talking immediately about, you know, when they're going to stop it, because as Sophia has said, people are scared of using nicotine. They don't use it for long enough. They don't use enough of it. So don't put into their mind straight away that they've got to look at the end point. Remember your yellow card reporting. Any adverse events can be reported on the yellow card system. And as I say, stress that they must use enough nicotine to get over their withdrawal symptoms. We see a lot of people saying that they'll use a vape, but only a 0 nicotine liquid. Get them to use some, a 6, a 12, an 18, because that will keep them from relapsing to smoking. Next slide, please. The NCSCT guidance that I referred to about incorporating e-cigarettes into your stop smoking service can't be done justice to just in a 5-minute talk. Go to the NCSCT website, have a look through it. It's full of really good case studies and suggestions on how to add vaping to your stop smoking offer to clients. It can be incredibly simple. You can just simply, buy some in, do direct supply, or it could be very much more tailored using your procurement departments. Have a look at the guidance. But remember, if you're arguing with a commissioner, for instance, who isn't sure that this is the right way to go, remind them that vaping is up to twice as effective as NRT, and it can come at 1/5 of the cost. You can refer to Peter Hayek's randomized controlled trial that was published in 2018 or 19, I can never remember quite the year. But many stop smoking services are already offering this as an option, and they are very willing to help new services or services that are newly offering this, in terms of what they tried. Look at the resource on the NCSCT and get some more ideas. Next slide, please. These are some ideas from me, having had experience of this. What you should tell people. And the second bullet point here, I think, is really important. Tell your clients not to wait for it to be prescribed. If they're going to wait, they will be smoking hundreds, if not thousands, of cigarettes in the meantime. They can go and buy one now. Even better, if as a service you can actually offer it to them. But go and buy one now. Give it a go. Even if they're still smoking at the same time initially, they can sort of get used to it, see what it does for them. Eventually, the message is that they should stop smoking completely and go on exclusively to vaping to get the best health results. I'm going to pick up on the last point here as well, given the time. Make sure your local healthcare community is aware of what you're doing if you're supplying or talking to people positively about vaping. You can talk to them about the NICE guidance, but make sure they don't undermine your patient's confidence, because we very often see a stop smoking service that is talking confidently to a patient about vaping and what it can do to help them stop smoking, and then they go to their appointment with their GP or their hospital clinician who say, I'm not sure about that. I fear that it could be just as bad as smoking. So make sure that they get the right information on a webinar. Sorry, background noise. Make sure that they are supporting the message that you're giving out to patients, not undermining it. And next slide, please, should be the last one. Yes, these are just some resources from the NCSCT. Do check out these links, particularly the films on the YouTube channel. They will be hopefully very informative for you and useful to share with colleagues. Thank you. That's it. And I think we can go straight to questions. Can we, Hazel?
Wow, what an absolutely tour de force there, Louise. I've been trying to answer some of the questions in the chat thinking we wouldn't get there, but here we go. Sophia and Allan, if you want to turn your cameras back on. Allan, I think you picked up the question about inequalities and whether Clearer helps you to kind of navigate those issues. But I wonder if you might sort of elaborate a bit further on how Clear can be used on the specific issue around kind of targeting inequalities. And then we'll pick up on some of the other interesting questions that people have raised as well.
By all means, if you think back, when you look at the slides again, you'll see that nice little triangle model. We talk about challenging services, leadership and results, but at the centre of that is the objectives and your local strategies and your local priorities. Now, reducing health inequalities will be a priority and a strategic priority in all areas. And what Clear then does is enable you to say, actually, how can your action on tobacco control contribute towards that? There are specific questions in there. So again, taking on the NICE guidance, but enhancing it a little bit further to say, can you demonstrate that you are targeting your commissioning your services and targeting them to your priority populations? And so they are priority populations because they are the ones that are experiencing inequalities. They're the ones you want to focus on. So it does actually help you target and your mind and actually make you do a bit of a stock take saying and a reality check. Are we getting to the right people? Can we evidence it? Are we sufficiently commissioning them as a priority? Are we monitoring the impact we're having as well? So there's very specific questions within the Clear tools for that. And let alone, we do also have obviously those deep dives focusing in on some key priority areas, such as population, such as mental health, such as smoking and pregnancy as well.
So as you raise mental health there, Allan, I was going to come to you, Sophia. So we had a few questions around mental health and somebody specifically asking whether the abrupt quit is now still the kind of recommended approach for people with a mental health condition, or whether we're varying that approach now.
Absolutely varying, and that's actually indicated in the NICE guidelines in words, because not everything can make its way in there, but absolutely. So emphasizing specifically that the not to stop in one go and the harm reduction or reduce to quit model is particularly well suited to individuals with mental health, and that's come through the Scimitar project in that approach being not the only option, but one option alongside abrupt quitting that suits that population particularly well. Yeah.
And it strikes me, and from your presentation and the conversations that we've had, is that one of the absolute key messages of this new NICE guidance is about pursuing much more flexibility with people in terms of how you work with them and the medication they might use, the different kinds of products, the way in which you might structure those sessions. That all of that is kind of emphasised by the new NICE guidance.
Yes, and without taking away the value of having structure too, right? Because that can be useful and can fit most people. Yeah.
Louise, there's lots and lots of questions about e-cigarettes, and we won't get to cover them all, but several people kind of asking variations on, is there a recommended list of e-cigarettes that we should be using? How do we choose which ones that we might engage with? Those kinds of questions. How would you answer that? I'm sure you get asked it often.
Yes, we do. One of the resources on the NCSCT website is how to work with vape shops, and I think that's a really good starting point, because chatting to somebody about what products are available will start to kind of shape your ideas about what you might like to provide. And most shops will have a very good idea of what's a good starter kit. Now, the brand doesn't matter particularly. You can be fairly sure that if you talk to an outlet that knows their customer, they will be able to advise you and pick something that isn't too complicated, but equally isn't too basic. That's what I would suggest.
Brilliant, thank you, Louise. We've got some questions as well about whether these guidelines applies to CAMS services, to children and adolescent mental health services. I have to say I'm not sufficiently familiar with them to answer that question. Sophia, are you?
There is a section dedicated to youth in the NICE guidance, for the most part promoting abstinence or not taking up smoking, but there's a little bit there. It's nothing too rich or comprehensive, I would say.
Mm-hmm. And there's quite a few questions coming through around the harm reduction approach and how people might, need to reorientate their services and how that might work with different client groups. I don't think in our remaining 3 minutes we could do that justice, but it does seem like something that as a group we could come back and talk a bit more about in the future. So I think we'll definitely make a note as Ash to revisit the harm reduction question. I can see people agreeing that would be useful. And also there's some questions particularly about varenicline in the chat, and whether we can expect to see that back to the market. I mean, others have posted as well. As far as we know, we can't expect it to return to the market anytime soon. But as I mentioned, we've got a webinar which Louise will be speaking on in April, which is specifically on pharmacotherapies, where we'll look at what's happening around Champix. We'll look at Zyban and other medications, and so we'll be able to explore that in a bit more detail. And hopefully by April we may have a little more information that might be useful to people. And also we've got a session on smoking in pregnancy coming up, where we'll be able to dive into much more detail about the implications of the new NICE guidance for delivery for pregnant smokers and how that sort of fits together with the new rollout of the NHS long-term plan as well. So I think rather than kind of go trying to scoop up any more questions, we'll go through the chat and we'll check whether there's anything else that we can respond to offline with people on some of the specific issues that people have raised. Thank you so much, Allan, Sophia and Louise, for sharing your insights today. We'll be circulating the slides from this webinar. We'll be circulating the recording so you can go back and revisit it. And we'll also, as one of the questions in the chat, be circulating the dates of the webinars which are coming up alongside a range of webinars which the British Thoracic Society are also running on, which are specifically around the long-term plan. So expect those in your inbox shortly. Thank you so much, everybody, and I wish you a happy Thursday.
Thank you very much, Hazel. Bye, everybody.
Thank you, Hazel.